Hey guys, and welcome back to my channel. I'm Sean Vasquez with A Mother's Nature, and today I'm going to be helping you decide which type of pregnancy care provider is best for you, what differences that will make in your childbirth experience, and what questions you should ask them in your initial interview. Stay tuned till the end where I'm going to provide you with my number one best piece of advice for choosing a healthcare provider during pregnancy. So, how do you picture your childbirth experience? Who, if anyone, is present? What type of pain management options would you like to have available? Would you like to have pictures and videos of the baby being born? Maybe you have certain medical concerns that require special care, and maybe there's a certain setting that makes you feel more safe and secure. Or maybe you'd like to have a little more control over your experience and have the freedom to do things your own way. Choosing a pregnancy care provider is so much more than just who helps deliver the baby. It's about where your baby is born, how the baby is born, and sometimes even when your baby is born. First, let's just talk about the different options you have as far as healthcare providers go during pregnancy. There's basically three choices: an OBGYN, a CNM, which is a certified nurse midwife, or a CPM, which is a certified professional midwife. A CPM may also be called a CM, just a certified midwife, or an LM in some states. Now, if you plan to have your baby in the hospital, you're going to be attended by an OBGYN or a CNM. So what are the differences between the three? OBGYNs attend to most births in the United States. They attend to hospital births. They are highly skilled medical professionals who are trained to deal with high-risk pregnancies. With an OBGYN, there would either be a solo or a group practice. So you may see just one doctor throughout your pregnancy, and that would be the doctor that would attend your delivery. Or there may be a group of doctors. You would see several of them throughout your pregnancy, and one of them would attend to your delivery. A CNM, or certified nurse midwife, is skilled in the art of nursing with a specialty in pregnancy and childbirth. They attend to mostly hospital deliveries, but they also may work in a birth center that is like an annex to the hospital or somewhere nearby the hospital. A CNM always works under the supervision of an OBGYN or a doctor, so you would usually see both of them during your pregnancy, and the CNM would attend to your birth as long as everything was normal and healthy, but the OBGYN would attend any deliveries that were more complicated or if there were certain health risks involved. I have actually seen rare cases where a CNM is also a CPM and they can attend home births as well. A CPM, or a certified professional midwife, would attend a home birth or a birth at a privately owned birth center that was not associated with a hospital but owned by the midwife themselves, or perhaps a group of midwives own a birth center. If it's group owned, you would meet all of the midwives throughout your pregnancy, but only the one who was specifically your midwife would attend to your delivery. Unless, of course, some sort of extenuating circumstances happened and they were unable to attend, then you would have one of the backup midwives from that practice attend to your birth. All three of these healthcare providers are more than capable of attending to any normal pregnancy and childbirth experience. But if you do have special concerns or certain medical conditions, you may have to birth in the hospital. So we've already talked about how the different providers can determine where your baby is born. OBGYN or a CNM is going to be a hospital birth or a birth center that is an annex to the hospital. And a CPM or an LM is going to be a home birth or a birth center outside of the hospital. There are a lot of differences between a hospital birth and a home birth, or a hospital birth and a birth center birth. You might choose a hospital birth if you feel safer or more secure in a hospital setting. If there is a doctor who you would specifically like to attend to your delivery that you feel comfortable with, maybe you've known them for a long time, maybe they attended to your mother when you were born. You may choose a hospital birth because you'd like to have different pain medication options available to you, like an epidural anesthesia. Perhaps you have certain medical risks or health concerns that require you to birth in the hospital with an OBGYN. Conditions like high blood pressure, lung, kidney, or heart problems, diabetes, autoimmune diseases, sexually transmitted diseases, or chronic infections like HIV could present risks for the birthing person and or the unborn baby. For liability reasons, there are a lot of different regulations, policies, and procedures that come along with hospital birth. Certain hospitals will not allow you to videotape or photograph the actual birth, like the baby actually coming out. In the description below, I have provided a link to a review in the Journal of Perinatal Education, and it is called First Do No Harm. It talks about the different interventions that can happen during a hospital birth and how those things can sometimes create a domino effect that can actually lead to other problems and health concerns. I really suggest that if you choose hospital birth, you take a look at that resource and make sure you know that you're prepared for the different interventions that are going to take place, what your rights are, the different decisions that you need to make, and the choices that you have available to you. In a hospital birth setting, visiting with an OBGYN, you will have limited time in your prenatal appointments, long waits usually, and your appointment with the actual doctor is probably only 10 to 15 minutes. Let's take a look at a few clips from a hospital birth video.
I just checked in and I'm excited, and
This is a typical low-risk hospital birth happening here.
I got an epidural, which was really kind of scary, but it was fine. So I'm about dilated to almost a 7, and I feel a little bit of the contractions, but one keeps bumping up the epidural. So
you can see the stirrups and the position that she's in, which is kind of the typical position that you'd be put in during a hospital birth.
Okay. All right, here, let's go take big deep breath in. Push back that leg, somebody. And push. Push. 2, 4, 5, 6, 7, 8, 9, 10.
You may choose to birth outside of the hospital in a birth center or at home if you want to be 100% in control of your own childbirth experience, if you want to have the freedom to kind of do things your own way. This would only be an option during a normal low-risk pregnancy with no complications. However, midwives are highly trained childbirth experts, and they are more than capable of helping a birthing person in an emergency situation during or after their childbirth experience. They are also trained to notice red flags very early on and able to transfer if the need arises. You may choose a CPM or a licensed midwife if you'd like a very personal experience. Midwives spend a lot of time with their patients. Your prenatal appointments with a midwife will last about an hour long. You'll be able to ask as many questions as you want or need to ask. You'll be provided with several different resources to help you with prenatal vitamins, nutrition, exercise during pregnancy, different ways to make sure that you're healthy and strong and ready for your childbirth experience. A lot of times people choose a birth center birth or a home birth with a midwife because that midwife has attended to the deliveries of several of their previous children, to their own birth, several of their siblings even. A lot of people choose a home birth because they want to be surrounded by their own things in their own environment where they feel comfortable. Some people choose an out-of-hospital birth because they had a prior experience in the hospital that was very traumatic. You may choose to have a midwife attend your delivery because you have read the midwife's model of care and it just really fits with your beliefs and your values. During a home birth or a birth at a birth center, there won't be so many different interventions, especially since all of the birthing people in these situations are low risk. One of the main parts of the midwife model of care is low intervention. Midwives let the birthing person take the lead and they kind of intervene when they're needed or wanted. Let's take a look at a few clips from a home water birth video. These videos always make me so emotional. So let's say you've decided where you want to have your childbirth experience, either in the hospital, at a birth center, or at home. And you've decided which type of care provider you'd like to attend to your birth. Here are some questions that you would want to ask them during your initial interview to make sure that they're going to be a good match for your values and your beliefs and the kind of experience that you want to have. This is a very important decision that you need to feel good about. Don't feel rushed or pressured into not asking these questions or skipping some of them or not getting the information that you want and deserve to have before you make a very important decision like this. What is their current C-section rate or their transfer rate to the hospital? What is their induction rate? What do they consider post-date? And what are the rules regarding that? Like, how far past 40 weeks are they going to allow you to go? And what kind of policies and procedures do they have following that? Are you going to be allowed to eat or drink during labor? Will you be allowed to move around and get into different positions during labor? In a hospital birth, you can ask if they have a squat bar available or different types of beds that actually move into different positions to make birthing more comfortable. Can you take a shower or get into the bath? What type of pain relief options will you have available? What are their views on episiotomies versus natural tears? Will you be able to push the baby out in different positions if you feel more comfortable that way? If necessary, do they prefer using a forceps or a vacuum in assisted delivery? And how long will they allow you to push before they proceed to an assisted delivery or a C-section? What about golden hour? Are you allowed to have immediate skin-to-skin contact with your baby after delivery? And if so, will they delay certain newborn procedures until after you've had that hour? What type of newborn procedures are regular at their hospital? What medications are administered to the birthing person or the baby? Are you allowed to delay the cutting of the cord? Will your partner be allowed to cut the cord if you want? How long will you have to stay after the baby is born? Is videotaping or photography allowed? And are there any rules or regulations regarding that? How many people are allowed to be with you during labor and delivery? How many people are allowed to be with you during a cesarean delivery? If you write a birth plan, will it be honored? Will a lactation consultant be available if I choose to breastfeed? These are just some of the questions that I thought were really important, but I did provide in the description below some links to some other really good articles that have some great questions for you to ask your healthcare provider before you choose if they're the right one to assist you in the delivery of your baby. So here it is, my number one best piece of advice for choosing a healthcare provider during pregnancy. Watch birth videos.
So many birth videos.
Read birth stories. Find the experiences that make you feel good and positive and use the information in those stories to make your own decisions and your own choices about which type of provider you'd like to choose, where you want to have your baby, how you want to have your baby. Research, research, research. You can never have too much information about something that is so important. Read books about childbirth. There are so many great resources out there. I have provided the links to some of my favorite birth story videos, some of my favorite podcasts about birth stories, and some of my favorite books in the description below. Ask tons and tons of questions. Write your questions down before you go because you will absolutely forget what you were going to ask them when you're in the moment. Ultimately, the most important thing is that you find a provider who cares about you and your child, that they're going to answer your questions, that they're going to provide you with information you need to feel safe, confident, secure, and empowered by your experience, somebody that you feel confident in, somebody who doesn't mock you or laugh at you when you ask them questions. You want to make sure that your care provider is somebody who supports your decisions and encourages you to make your own decisions. Somebody that you feel is knowledgeable, understanding, compassionate. Honestly, you can tell a lot just by the way that they speak to you, their tone of voice. If you feel like they're condescending to you, they're probably not a good fit. If you come in there with a list of questions and they automatically roll their eyes at you, that's probably a sign that they're not a good fit. If they make you feel rushed, like they don't have enough time for you or for your questions. If they make you feel like your questions are stupid. If they make you feel like you're not in control, they're probably not a good fit. Remember, you are the one paying the bill. You are the one in charge. This is your experience. Choosing the right healthcare provider during pregnancy can have a huge effect on whether or not you have the childbirth experience that you want and deserve. I have seen so many women be disrespected and treated like they are not important, treated like their opinions don't matter, or the things that are important to them don't matter, like they're ridiculous, or like it's laughable that they want to have some sort of control in their own experience. You can have a great childbirth experience if you find the right provider. Okay, guys, that's about all I have for today. I'm going to wrap it up. Please subscribe to my channel so that you can stay up to date on all of my latest videos. I hope that you will use the information in this video, the links in the description below, as well as your own independent research to make informed and educated decisions. Thanks for watching. I hope you have a great day.